Hey guys, what's up? It's Stephen Dunn from Core Therapy and Pilates, and I hope you're staying safe. I hope you're staying well through this crazy coronavirus pandemic that has taken over. And what I wanted to come on today is just to give a quick message. Many people have been asking, what is telehealth? Because one, the president mentioned telehealth several days ago in one of his press conferences. And that was a word that many people didn't really know what it meant, and it's become a very buzzword since then, but still people don't know what it means. And so I wanted to kind of go over that a little bit and tell a story of a telehealth session that I had just today with someone, and it was really kind of cool. But anyway, telehealth is basically a version of healthcare that doesn't require you to go anywhere. It requires a FaceTime interaction or a Zoom type of account, a Zoom type of link or a Zoom type of platform. And what it is it's a face-to-face interaction where there's obviously no hands-on in that situation, but it's a discussion of what's going on. Pain-wise, pain isn't going away. Injuries aren't going away with this pandemic going on. In fact, we're gonna see a ramp up of injuries, and I'll explain that in a second when I go to my case study from today. But the reality is that this is our immediate future right now. Telehealth is our options to help people. If you're having back pain, you're having neck pain, doctors, they're at a point where they're not going to be able to help you, and they don't want you coming into them for that. They want their resources to be saved for this virus. And so if you're having back pain, what do? Well, this telehealth session is a way that you can come on. Hey Annie, how you doing? Thanks for hopping on. This telehealth session is a way that you can come on. We can get together, listen to what's going on, listen to the problems that are arising, and come up with a plan to help. So let me tell the story of what happened this morning with one of my clients. So one of my clients, she's not working. She's been at home for now about 4 or 5 days, and she has a Paleton bike. And she's been riding her Paleton bike every day, and she's been walking more and exercising more than normal because she's not working. Well, in that process, hey Ray, what's up, buddy? Thanks for hopping on, man. But in that process, she started getting a little bit of some zing into her arm from her ulnar nerve from on the bike. She started getting a little zinging into her sciatic nerve from being on the bike and just moving more. And what she did was she said, hey, I can't do the virtual classes. I wanted to take the virtual classes, but now I'm flared up. And so what we did is we met, and she set up a 15-minute appointment. And the 15-minute appointment ended up stretching into about a 30-minute appointment. And what ended up happening was I took her through a brief movement assessment of her neck and her back, and by doing that, I could figure out immediately what was going on with her from what I already know about her and her history, but what she's been doing in the time that she's been away or she's been home in her self-quarantine. And by watching her move through the video, I was able to determine that there were a couple things that were not moving correctly and not in the proper situation. So I gave her a few cues and a few tips to do, and she did them right there. And we did a few things with a ball, we did a few things with a foam roller. It took about 5 minutes to go through those few things. And then I took her through some basic spinal motions, some spinal flexion, some spinal extension, some side bending, some rotation, and a quadruped position, and in a sitting position. And I basically took her through exercises that I would normally teach people in my clinic, and within that 30 minutes, it was a 15-minute that ended up going about 30 minutes, she was able to get up and feel completely comfortable. She was feeling better, and the pain that she had been experiencing from being on the bike earlier that day was now gone. And really, we just kind of got her out of this place of fear to let her know that she can move. Because what's going to happen if you do have pain, which a lot of people are going to have pain from the stress, from the finances that are going on, and so many things that are going on, that it is going to spike that pain. And then all of a sudden, you're going to not move because you think movement is bad. Well, movement is what you need to be doing when you're in pain. And it's up to us to guide you to move correctly with the corrective exercises that you need for your situation. So I just wanted to share that because it was really fun. This is my second telehealth session now, and it was just really exciting because both of them two totally different situations, two totally different, a male and a female, totally different things, and it went really well with both of them. And so I just wanted to share that in this time where everyone's scared and everyone's fearful on what to do and how to handle things. We're still here to serve you. We're still here to help you. Moving your spine and getting your back strong is a very important thing that we can do in this time. And so I just wanted to share that story and let people know that this is a different time, and how can we help you if you can't get out of your house? Well, telehealth is the option. And we have these virtual classes that are going on that are really fun as well, and that's something totally different that is not telehealth, but is virtual fitness. And that is definitely the wave of the future, and it might be something that sticks around forever. It might be something that we just do for a short time until the dust settles. But right now, this is what we got for another month here in Austin. So with that said, guys, that's what I got for you. Thanks for hopping on, the guys that hopped on. If you have any comments or questions, put them below. We are here to help. We are here to serve you. Yes, it's not in person right now, but we have many options virtually. So thanks, guys. Y'all have a fantastic day.